From Robert Wood Johnson University Hospital, this is Medically Necessary.
Welcome to Medically Necessary, the official podcast of the Robert Wood Johnson University Hospital medical staff. I'm Chris Hoenig, joined as always by Dr. Jim Salwitz. Dr. Salwitz, another beautiful day in the medical neighborhood.
Chris, it's nice to see you. I hope you and yours are well.
As with yours. And, you know, it's great that now that we are fully vaccinated, the CDC out with their guidance for fully vaccinated people, we could actually be together in a room without masks. We could hug. It is so nice to kind of get that little bit of normalcy back. It
is, Chris, but unfortunately, that does mean I have to start showering again.
That's what the smell was. I was wondering. We've been keeping your office door closed just in case, but we weren't really sure.
I thought this was because you didn't like me, but okay.
And, you know, we laugh right now, but this is a very serious, a special episode of Medically Necessary here. We're looking at an initiative that is so key to what Robert Wood Johnson Barnabas Health is. And with that, I want to welcome our guest this week, Celeste Warren. She's the Vice President of the Global Diversity and Inclusion Center of Excellence for Merck. She's also a member of our RWJBarnabas Health Corporate Board of Trustees and one of ROINJ's influencers, a difference maker on the People of Color list for 2020. So congratulations on that.
Thank you.
And also, before we get into the conversation here, I just want congratulations to Merck. What an awesome bit of news that came out a couple weeks ago. Merck and J&J working together with the U.S. government to help produce the COVID-19 vaccine. And obviously, two great New Jersey-based institutions, Robert Wood Johnson University Hospital. Of course, we have a wonderful past with Johnson & Johnson, but it is so great to see two rival institutions in New Jersey working together on such a worthy cause.
You know, when you get to this point of the pandemic and you're trying to save lives, you have to throw competition out the side and come together to be able to do just that, save and improve lives. So I'm glad that this partnership is coming to fruition.
And we talk about saving and improving lives. You are also the chair of the board's Ending Racism Together Committee, this initiative to create an anti-racist corporation in RWJBarnabas Health, so vital to the future of this company, of this industry of healthcare, and to really our culture, to our country, to our world. And obviously working at Merck, that is, I can tell you from my past life, having worked in the D&I space myself, a model organization. D&I at Merck is not just a business model, it's a business mandate. And you guys really take a leadership with that, and you're able to bring that experience to RWJBarnabas through the board.
I am lucky to have the opportunity to work with Barry Ostrowski and the rest of the board. And when he asked me to take this on and chair this committee, this subcommittee of the board, the first thing that was running through my thought was, I'm already on two committees. Can I do a third one? But this one is so critical and it's so near and dear to my heart, and it's my passion. I absolutely, and you know, we know that we can't say no to Barry, so so I said yes, and it has been it's been great from the standpoint of, first of all, the leadership that Barry is demonstrating in driving this. And his commitment and his passion around diversity and inclusion has just been phenomenal for a CEO and a role model for other CEOs. And then the team that is working within RWJBarnabas, the committee, the management committee, is doing a spectacular job. We just had another subcommittee meeting this morning, and the way that they're approaching it is very holistic. It's very multidimensional, and it just proves that you can't approach it in one way, because this is a problem, a challenge that has been going on for centuries, and it's not going to be fixed overnight, but you have to take an intentional approach to it. And I just salute Deanna, Vincent, and the rest of the team for the work that they've been doing.
So I think, Ms. Warren, you point out that Barry, from the very start, from the moment we came together as an organization, now almost 5 years ago, made D&I a core value for the organization, and has continued obviously to push that forward more and more as we go forward, and making that a core of who we are, how we become strong, how we serve our communities, how we make our communities healthier. So what are the kind of concepts, directions that you see this committee, but also more broadly the organization going forward, as we start to really build formal structure to make this happen?
Well, they're approaching it in a very planful and purposeful way. They're in the formation stages right now, but they've written the charter, and they have 4 what they're calling strategic goals. The first is around the patients and making sure that all patients, regardless of whatever dimension of diversity they come from, whatever community they come from, whatever culture they come from, that they're afforded safe, high quality, equitable, and anti-racist care, which I think is the cornerstone of what RWJBarnabas is about. So that's the first one. The second one, they're looking at the workforce, the internal workforce, and making sure that the workforce has the opportunities, the aspirations, the potential, that everyone has that within the workforce to be able to achieve whatever career aspirations they might have, to be able to elevate their voices so they're heard without fear of retaliation or retribution, that they're able to have a culture within the organization that is one of inclusion and empowerment. And so that's the second goal. The third area that they're working at, and we just heard a little bit about this morning, is around communities, and looking at the communities from the perspective of the health, the social determinants of health. And so looking around the patient, not just the health of the patient, but what are some of those things in their ecosystem that are barriers to them being able to get the ultimate health care that they need to. So they're looking at the communities and different aspects of income, family income, housing, what's in the neighborhoods, what's in the communities. So all of those things are what we call social determinants of health, and very important. And then the last area is looking at the operational processes, practices, policies, procedures that fall outside of the 3 areas of patients, workforce, and communities that they might need to address, that are on the onset, not intentionally, but they may be unintentionally causing challenges when it comes to equity and inclusion within the health system. And so that involves looking at funding and the foundation and where grants and where they're going to, what projects, what initiatives, what organizations. As an example, supplier diversity, for example, and the work that's being done there with vendors and suppliers, which has an impact on the economy. So those are just a few of the things that they're working on. But those are the 4 strategic goals around patients, workforce, communities, and the last is around operations. And that's how the team is taking this very holistic approach to how they're approaching it. They're working too with a consulting firm, Ivy, that's taking all of the data, from the patient data in the health system, the internal workforce data, data in the state of New Jersey, putting all of that together to really do the analysis and then come up with what they need to do next, which would be talking to employees. So they're doing this not in a linear approach, but they're doing it from the perspective of they're doing the analysis. They are talking to employees and have been talking to employees. And so they'll put all of that quantitative data and the qualitative data together and come up with a game plan and how they're going to approach it from a strategic standpoint, and what that implementation and execution, where I like to say where the pain points are in the organization and what they need to go after. So it's a really good planning process. They're being very purposeful about it. They're focusing on the right things. And I can't wait to see, what comes out of it and how people receive it.
I think the power of data or information, in this situation, it cannot be overstated, because, I mean, it's one thing to say, that there's a group that's underrepresented. It's another thing to say, well, that group is only 3%, despite its base population being 25%. I mean, that, that, and then also that gives you metrics, not only so that gives you metrics to wake you up and identify problems, but it also gives you, goals, that you can start to focus on, and, real endpoints, because, I think there can be as a tendency in this area, to think it's soft science, if you will. Mm-hmm. But, we can identify the issues and then start to walk them through and find out, to your point, where the pain points are, where the the obstructions are, as far as what causes the greatest challenges in the, to moving forward. But, all this, it makes for an empowered, stronger organization, and that organization just happens as a goal to have it's its primary goal to make the health of New Jersey better. Mm-hmm. So it's hard to overstate the importance of this, or the opportunity, or, as you point out, get very excited about taking a very deliberate step-by-step approach, and this is not kumbaya, this is a structured process to building a world-class, medical system.
That's exactly it. And when you talk about building a world-class medical system, it is about the people. It's about, first and foremost, it's about the people. And the people within the workplace that are interfacing with the patients to make sure that they are having the best experience that they can have, given the challenging reasons why they have to come and see your workplace, your workforce. So I think that combination is just really, really critical. It truly is, for RWJBarnabas, a business imperative. If there was any other way to say it, it is a business imperative. When you think about the 4 ways that they're approaching it and what they're looking at, it is all about your business and your business of saving and improving lives.
I mentioned this to you in our previous conversation, the recent podcast with Barack Obama and Bruce Springsteen. And President Obama comments at the one point in the podcast that what he thinks is the greatness of America is in its diversity. He doesn't mean that just, he says clearly, it's not just a potential. He thinks this is one of the things that it's made it great, but also will make it even greater going forward. It is that our ability to use everybody, to roll in the same direction and learn from each other and go together. And I think the same thing is here. This is the kind of thing that can allow us to achieve the goals that we want to achieve. I mean, Robert Wood Johnson, it's an academic institution. Its eventual goal is to cure cancer. Its eventual goal is to eliminate Alzheimer's disease and childhood poverty, and all the things that make people's lives full of suffering. To better health. So that's our goal as an academic institution. We can't achieve that without achieving these goals. Can't be done.
I agree wholeheartedly. Absolutely.
So you actually worked for, as Chris was saying, for an organization that has a remarkable history in this area as well. Merck has done some really cool things.
Yeah, when I stepped into this role 7 years ago, the leader of the Global Diversity Inclusion Center of Excellence for Merck, I was stepping on the shoulders of some remarkable CDOs previous to me. And they really did a good job in laying the groundwork and the foundation around diversity and inclusion and taking it to a level that was, even back then, was beyond where the rest of the world was, frankly. And when I came in, I was looking around and thinking from the standpoint of where the world is, where it's going, and the impact that has on our employees and our business as a pharmaceutical company. And started just going around and listening to people. And I listened to people who, that were passionate about diversity and inclusion. I listened to some people that were kind of ambivalent about it. And then I listened to people that just didn't understand the importance of it, frankly. And you have to listen to all of those different ideas and beliefs, because if you're going to create a strategy that truly is about diversity, equity, and inclusion, you have to be able to include all those viewpoints and be able to reach people where they are and bring them forward. And so for the most part, our purpose around diversity and inclusion is just to compel a more diverse workforce for our employees by creating an environment around them of inclusion, equity, empowerment, so that they can do the jobs that we want them to do. And that is, our mantra is to save and improve lives. And when it comes to our animal health business, it's to basically ensure that our business and the people that are doing the business and our customers feel the benefits of our services and our products. And so that's basically kind of our purpose statement, we call it, around diversity and inclusion. It starts with the employee. We create an environment around them where they're able to do what they need to do. And ultimately, it's going to benefit our patients. Sort of I call it the employee ripple effect, is basically what it is. And we look at 4 different areas. First is fundamentally is creating a diverse environment, making sure that our employee base, the diversity of our employee base, mirrors the diversity of our patient base. That's number 1. Secondly, we want to create that environment of inclusion, that culture of inclusion around the employees, so they can feel empowered, engaged, energized to be able to do what we need them to do. The third piece, and people kind of look at me, I remember when I first, got into the role, and they were looking at me kind of like I had 3 heads, because I said, at that intersection of diversity and inclusion and business performance, you create a competitive advantage for the organization. You have to look at our research, our manufacturing, our commercial, and our sales strategies through a lens of diversity and inclusion, because our patients are diverse. And if we don't understand what's going on in their lives, then how can we create our services, our medicines, our drugs to meet their needs? And I always tell them, I said, it's not enough for us to interpret what we think patients in certain communities are going to need, what their challenges are, but we have to have employees with those same experiences sitting around the table, the boardroom, the conference rooms, the manufacturing sites, the research labs, sitting around those tables that are saying, here's what's happening in this community. Here's what some of the obstacles are. Here's why they're not experiencing and having the ultimate health outcomes that we want to see. And they're able to talk through it. Because otherwise you have a bunch of people that are guessing, surmising, and assuming what they think patients need. And that's not how you want to run your business. It's not going to be successful. And then the last piece is, it's not enough that we do what we need to be doing inside our own 4 walls, but we have to look outside, pull our heads out of the grindstone, look outside, share best practices, learn from other companies, so we can together increase the external environment, the culture, and the business landscape. And that's basically kind of the 4 areas that we focus in: representation, inclusive culture, integration into the business, and then looking outside and making sure that we have an equitable environment when it comes to health equity, when it comes to social determinants of health, all of that. We call it the situation around the pill, around the vial, to make sure that our patients are experiencing the health outcomes that we want them to. All of our patients across the globe, all walks of life. And that's the critical aspect of why we're approaching it.
Of course, it is remarkable that this as a model just for leading any organization, just communicating with your people, supporting your people, listening to people and your customers anyway, and it is incredibly powerful. So you solve, in trying and working to solve, and improve, the diversity environment, you actually make the entire organization more open, more communicating, more fluid, and more powerful.
Yeah, and the nice thing about it is, we know that we hire people to come into our organizations for functional skills and capabilities, the best physicians, the best nurses, in our case, the best scientists and engineers and salespeople and marketers. And they know that they're coming in with that functional capability. But how nice is it to be able to come into an organization and be able to bring also your culture and your experiences and what that is in your community, and bring that to the table as well, to be able to talk not just about my skills as a marketer and my marketing strategy and my sales strategy, but also to talk about, here's what's happening in my community where I live with, the African American community or the Latino Hispanic community or the Native American community. Here's what's happening, and let me talk to you about what's happening in those communities, and being able to bring all of that to work. Can you imagine how powerful that employee will feel, and how well-rounded, how they're going to feel, how good they're going to feel about bringing that value to the organization, because it truly is value added, and knowing that they're adding and contributing to the business and to the organization in so many different ways beyond just their functional skills and capabilities and their disciplines. It really does make our employees feel truly empowered and value added to the company.
And it's really a righteous cycle of healthcare.
Mm-hmm.
Yeah, that's really a really neat way of looking about it. And again, I think all of our hospitals are part of their communities, and people feel that they're working to support the communities around them. And this gives them even more potential for helping my neighbor, helping my family, helping to make a real difference right at home, and at the same time, at an academic level, making these other broad changes. So truly remarkable. What should we be people looking forward to seeing in this area in the next 6 months, the next year? What kind of initiatives or information will we be rolling out, do you think?
I think, as it impacts the employees, I honestly think that the data is going to tell a very compelling story that's going to lead to actions that are going to make sense. So the first thing I think for folks is, from a change management standpoint, everybody intellectually and I think from the heart believe that diversity and inclusion is a good thing, it's a moral thing. But I honestly, when it comes down to, well, wait a minute, you mean I have to do something differently? I have to come in and do this differently and that differently. When it becomes integrated into their day-to-day flow of work and flow of life, then you start getting some of the hands up and like, oh, wait a minute. I really did think this was a good idea, but the devil's in the details. And so you have to be able to tell a very compelling story based on, like I said, here's what we're hearing from employees, here's what the data is showing, and as a result, this is what we're doing. And I honestly think just early on in some of the data that I've seen, and it hasn't been a lot because, as I said, Ivy, the consulting company, is putting a lot of this together. But there are some low-hanging fruit that I think that everybody is going to say, well, yeah, you're absolutely right. So, for example, the course of the pandemic, people have been, impacted by this drastically. Everybody has, but especially those that are in underserved communities, underfunded communities, underrepresented communities, and they're having to really struggle with that. So during the height of the pandemic, during the height of it, when we saw huge numbers, you knew that some of the transportation systems, as an example, that some of the bus drivers, they were getting sick, and so some of the buses and the transportation systems, they weren't as prevalent as they were prior to the pandemic. And so people that depend on, employees that depend on the public transportation system to get to work and have to take one or two, and in some cases 3 buses, and then have to walk a little bit to get to work. Well, you need to give them a little bit of slack about arriving a little bit late. And so, in those cases during the course of 2020, you saw that when you look at the data, there might be opportunities to look at your policies and see how it is disenfranchising demonstrating disparate treatment for those that are underrepresented. And so, especially persons of color in this case, women in some cases where they're having to be, working, they're having to find out what they're going to do with their children when the schools were closing, how they're setting up virtual education at home, the daycares were closing. So all of these things were going on in the lives of our employees. And so what were we doing about it? What were we doing to help them? Were we just still sticking to the rules and all of the regulations and saying, firing people because they missed their attendance and all of that? So some of these things have to really be looked at to say, what is it that we're doing that's getting in the way of us being able to have a workforce that it truly does feel engaged and empowered, and how that the ripple effect from the standpoint of your patients. We were talking about this morning. Some of the best ambassadors for diversity and inclusion and for what you want to do in the patient communities are your employees. And so when you think about all the things that we want to be doing from the standpoint of the patients and helping them, going beyond just the physical health, but also mental health and what's happening from the standpoint of in their communities. If you want to be able to do that and communicate it well, the best ambassadors you have are your employees. So treat your employees well, treat your employees with respect, do the things that you need to be doing with your employee population, because they are the best ambassadors that you have for the patients in the communities. And that's kind of, some of the things I think we're going to be looking at. Policies that might be changing or contemporizing, let me just say that, contemporizing, because it's really, really important that they are contemporizing, that we're keeping up with the times and keeping up with what's happening in the world and how it's evolving, and making sure that we're able to meet the needs of the patient. So there's going to be there's going to be changes, and people are going to have to learn to understand them. They understand why they're happening, and then embracing them and being able to be ambassadors for that change. And it's going to be a process, and it's not going to be easy, but it's definitely going to be necessary.
And I think one thing that you said in there too, it makes it even more important to even just take a step back and look at it through the bigger lens. D&I, a lot of people associate it immediately with race and ethnicity. And as we look at the way the pandemic has affected diverse groups, it's not just race and ethnicity. Yes, that exists 100%. It is also gender and the way that women and working mothers were affected by this pandemic. It is also disabilities and the way that people who have disabilities may be immune compromised, maybe their mobility and they need to touch more surfaces and things like that, the effects that the pandemic has had on them. Veterans, mental health for veterans. This has created a huge challenge for that population. And so it's really important to take a step back. And as we work our way into these initiatives, remembering that D&I is a much bigger picture than most people tend to put that lens.
That's absolutely it. We tend to look at it very myopically and not thinking about all of the dimensions of diversity. You talk about veterans. 2020, when we think about our veterans, we're used to them going and being deployed across the seas, across the pond, Iraq, Afghanistan, etc. But being deployed on our own domestic soil to fight what they may not necessarily believe in from the standpoint of the protesters, from the standpoint of protecting our capital in January. All of these different things cause another aspect of stress on our veterans from the standpoint of their personal values and beliefs. And that really came to a head this past year with them being deployed on domestic soil and the way that they were looking at it. And so that's just an example. When you think about you talked about persons with disabilities, these individuals had to learn to work differently. They're constantly, every day, every hour, having to I call it troubleshoot the environment, and adapt and change the environment so they're able to be productive in the workplace. But then within a second, we were told we had to work from home, most of us. And so now, what do? I don't have a home office. I have all of the things that I need, whether I'm hearing impaired, whether I'm visually impaired, whatever my challenge might be. I had all those things set up in my office at work. And now, like, how do I do this at home? How do I change everything? Individuals who have various different disabilities from an ergonomic standpoint. People didn't have that stuff all the time in their homes from the standpoint of a work setup. They had it from a personal setup and not a working environment. So, all of that. And we talked about women and having to have to be the new teachers and professors and CFOs and COOs and primary care physicians in their respective families. And, just the stress of that alone, we know that 2020, we saw just in record amounts of women leaving the workforce because they just could not manage it all. And so, having those conversations with them to say, first of all, are you okay? What do you need? How can we help you? How can we help you to manage it? What type of contracting do you need with your manager to help you to manage in this situation? All of those things, are really, really important from the standpoint of all of the dimensions of diversity that are happening. And of course, from the standpoint of race and ethnicity, we know that COVID adversely impacted those in the persons of color from the standpoint of Native American, Latino, Hispanic, Asian, and Black, of course. And then the pandemic from the standpoint of the hate crimes that we're still seeing in the Pan-Asian community is just so incredibly sad that this is going on with our Pan-Asian colleagues, and the hate crimes that we're seeing and the rise in the xenophobia. It has just been so very, very challenging for this community. 2020 was a time where D&I was just amplified, and everyone, unless you were just hidden under a rock, understood the importance of it. It called for new leadership skills too, with our leaders. Different leadership skills of being able to, all those things that we made fun of in the past, those soft skills are just prominent, and you need them. They're a necessity now with leaders and managers to be able to lead inclusively and put psychological safety around their employees and listening with empathy. All of those different things are so very critical now.
It's interesting. So many of the things you're talking about now in building this are making our organization, of course, society itself, but in this case, our organization, prepared for the next pandemic, if you will. Mm-hmm. We have in our lifetime been through multiple pandemics, none as bad as this one, but Ebola, H1N1, HIV, and now COVID, and now COVID-19. There will be more traumas that come forward, and as an organization, that is our job to respond to the community and be ready for that. And so much what you're talking about is building the foundations to be a better healthcare system that is ready, or more ready, to move forward. And this country, unfortunately, has a history of neglecting its public health and not having those structures. And while I would hope that we will continue to fund public health initiatives, history doesn't necessarily guarantee that. So that I think it becomes a critical role for us to be ready for the next hurricane, the next violent event, or the next disease. So this is, we learn these lessons, we build on top, we become stronger, and we get ready for going forward. I think it's so interesting that you're already anticipating the emotional needs of vets who had to act on their own soil in a conflict environment. I didn't perceive that as coming conflict, but yes, of course, I thought, so that's already you're thinking ahead of what we learned from the past. Now, where are we going, and who's going to be now have these needs? that's a really good example of that kind of thinking and that building that kind of an institution.
Let's also be clear that so many of these processes, these policies, these different actions that we're going to take on this journey align 100% with what it means to be a high reliability organization and what it means to RWJBH as we grow through this HRO journey.
Absolutely. And coming out on this on the other side of this, it's an evolution, but the work that RWJBarnabas has done and is doing and is going to be doing, you guys are going to be such a role model for other health systems across not just New Jersey, but I mean across the nation. It's just, I'm excited to be a part of this journey.
We're certainly excited to have you leading us on this journey, and we're really thrilled, for your insights and obviously for taking the time to talk to us today, Celeste. It's a remarkable opportunity for all of us, and look forward to working with you going forward.
Well, thank you for having me, and it's been fun. And I wish everybody the best of luck. Just hang on there. I know all of you are working many, many, many hours, and to your point, haven't been able to take showers, but the vaccinations are coming, and thank you so much for all of the work that you all do.
Celeste Warren, Vice President of the Global Diversity and Inclusion Center of Excellence at Merck and a member of our RWJBarnabas Health Corporate Board of Trustees, the chair of the board's Ending Racism Together Committee. Thank you so much for the time today.
Thank you.
As always, you can subscribe to Medically Necessary on all of your favorite podcast platforms. We're available on Apple Podcasts, Google Podcasts, Spotify. We have the playlist on YouTube, and you can always find us on the Robert Wood Johnson University Hospital Medical Staff Portal. For Dr. Jim Salwitz,
For Chris Hoenig,
thank you for listening.
Medically Necessary, brought to you by the Robert Wood Johnson University Hospital Foundation.